to make concessions. Are there any issues on which you will not budge, or is every issue one that is open to debate?
I think there are two that I feel very strongly about that I don't want to budge on. The first is the public health care. It doesn't matter to me if they call it by a different name or whatever, but here's what to me is the purpose of the public health care plan option. And this issue is going to come up anyway, so I'm answering two questions here. 70% of all private health care plans in the Philadelphia region, I'm talking about the outlying counties nearby, where about 40% of all Philadelphia, Pennsylvanians live. About 70% of all the private health care plan options are one health insurance company. We used to call that a near monopoly. Throughout Pennsylvania, and the numbers, it used to be up until 2 days ago, 70% of all private health care plans throughout Pennsylvania are two companies. There's a new figure out, I understand that it's a little lower now, around 65%. But that's kind of a duopoly. My concern is this: as I've gone to hospitals in my district, one of them is an independent one, the last independent one in one of my three counties, is they try to negotiate best fair prices. They don't have that kind of bargaining power. The value to me of a public health care option is this. You know that exchange you had where everybody can put in whatever health care plan they want? Now I'm going to talk about that more, about what minimum benefits are and all that. I think a public health care plan option does the following. First of all, it's subsidized in the bill by the co-pays and the premiums of those who join it, not the government. Number two, it is a choice. Those companies, those small companies the woman asked about, they have a choice, those 15 people in a small business, to pick that one or any other one they want. A choice. Number three, they do not pay $23 million every year to their CEO, nor the $50 to $70 million So, according to the Congressional Budget Office, that plan actually saves about $150 billion. Will save us about $100 billion over 10 years. So the concept is, okay, you got an exchange. What are Americans best at? Well, that's wrong to say. One of the things we're very good at, competition. We are. We're very good at competition. And so the concept is, make it a little bit more fair, however, that when that public health care plan is in there, offering the same benefits that this private person does, but it doesn't have the overhead, that they have lower costs. People say, well, I really like that. It gives me the same benefits. And so you could get the kind of competition that we lost in the healthcare market. So from a business aspect, you have a more competitive playing field. So the concept is, and by the way, mind you, it's overseen by the Secretary of HHS, but basically it's run by the same private funds. Unfortunately, it's gotten a misperception out there of what it is. Now, you can agree or disagree with what it is, but that's what it is in the bill. Now, you could have that by some other means. You know, people talk 1,000 people in it to get that type of competition. And it has to be nationwide, that not just in Pennsylvania like the President did. So I want to have that competition. So look, what happened, to your wonderful question on Wall Street, what happened was, in 1999, they forbade, by a law, by a vote, any regulation, oversight, reserve requirements for derivatives. Well, all we're saying is, let's have a little bit more fair play. I mean, even Little League football